Acromegaly is thought of as a rare disease with very specific characteristic manifestations. And these manifestations can include changes in the way the patients look, so coarsening of their features, increased in the size of the tongue, teeth shifting, and enlargement of the hands and feet, which is what we call acral enlargement. The problem with looking at acromegaly in this fashion as a disease with pathognomonic features is that these features develop slowly over the course of years, which tends to delay the diagnosis by more than 5 years. In the past, it was actually more than 10 years that a patient would experience in terms of a delay from when the first manifestations occurred until the correct diagnosis was made. I think the recent literature shows some progress, that there is a delay that, of only about 5 or 10 years, but this, I think anyone would agree, that is still a very long time. So the problem with having a delay between manifestations and diagnosis is that chronic exposure with high growth hormone levels would actually cause comorbidities, complications, things like cardiovascular changes, from high blood pressure to heart problems, hyperglycemia, changes in the bones. And during this time, the tumor has time to grow and become more invasive and more difficult to remove in its entirety by the neurosurgeon. So in my practice as a pituitary specialist of more than 20 years, I have started to think and to educate people in a different fashion. We shouldn't be waiting until anyone is able to make this diagnosis. We should instead look for a cluster of characteristic manifestations, such as increased sweating, carpal tunnel syndrome, and that may be in conjunction with other things that are actually common in the general population, such as hypertension or joint pain or hyperglycemia. I think if we look at a combination of suggestive manifestations and symptoms, we would make the diagnosis sooner, and with this bring the patient to the correct to the correct physician and have the correct treatment sooner than before.